Introducing the African Diaspora News Channel app, your gateway to stories that's overlooked by the corporate mainstream media.
And we serve as the voice to the so-called Black community.
Again, we got Dr. Candace Matthews.
A lot of these documents, looking at.
We are committed to informing and educating through the power of media.
This country is supposed to be about the land of the free for all. It has not been free for Black people, and we are tired.
With our platform, we're helping to end injustice by exposing it.
Join us in standing for excellence in journalism and serving our community. Download the African Diaspora News app today.
Research shows that Africa gets fake or substandard medicine, and it is directly connected to thousands of deaths in Africa. According to reports, a fifth of medicine in Africa could be substandard or fake, according to a major research project raising the alarm over a problem that could be contributing to the death of countless patients. Researchers from Bahir Dar University in Ethiopia analyzed 27 studies in the review and found that out of the 7,508 medicine samples included, 1,639 failed at least one quality test and were confirmed to be substandard or falsified. This is sad because someone can go to the hospital needing medical attention and can be given a drug for that problem, and he can go home and die because of the medicine that was given to him, because either it's fake or it's substandard, which means it's not only failing to fix the problem this person or this patient is already going through, but it also adds to the issues, because sometimes we hear people are sick and they need help. The sickness is not going to claim their life if it's treated, but then they are never getting that treatment and they pass away, or even worse, on top of what they're going through, they're given a drug that is going to impact either their liver or something else, and now they have more issues than when they first had a problem. So clearly this is an issue. If out of the 7,000 medicine that was studied, if more than 1,000 of them are faulty, imagine, this is one research, right? This is in Ethiopia. Now imagine this research being done across Africa and how our people are impacted. We've done stories on this channel when it comes to drugs affecting babies, actually unaliving them, medicine that is given to them to help with something, but then ends up unaliving them. We've talked about the jab, how it affected certain groups of people. So this is a problem that we are facing, and we're glad that people are talking about it and it's being raised, but it's not going to change unless and otherwise we take the responsibility of creating our own medicine. Some countries are trying, including Ethiopia, which is good, which is great actually, not just good, but we need to do more. Africa has so many countries in it. We cannot be depending on big pharma. On top of the drugs that we're getting being faulty, there's other issues like affordability. They are expensive. Most of this medicine that come to the continent, they are extremely expensive. A lot of people can't even afford them. So what happens is some people don't get the drug, even though the disease that they have could have been fixed. They never address it because they can't afford it, or in this case they address it, they go and use their money and they buy the medicine, and they still end up in worse position than when they started off. So we need to address these issues from our side as well. We should not be dependent on these companies. Look at India and what they're able to do. They reverse engineer these medicines that are so expensive that a lot of people can't afford, and they sell it for under $10, under $50, and they're able to save so many lives by their generic medicine. So what stops us from doing that? I know Big Pharma makes it very hard, even for Indians. They keep blocking them. There's lots of lawsuits. There's a lot going on there because they don't want the medicine to go out there and save people without them getting money off of it. It's a really corrupt and sad industry. But at the same time, look at India. With all the odds stacked against them, they still are able to accomplish a lot when it comes to the generic medicine that they create. Granted, there are issues even with that aspect, and there are so many stories that we hear, but at the end of the day, the bigger evil is that at least the people that can't afford the medicine can have access to the generic one. So imagine if at least half of Africa starts producing different kinds of drugs. We can sell it to one another and we can save thousands, if not millions of lives. So I think it's worth considering. This is a big problem now that we know that there are fake medicines coming to our continent. They are substandard. Clearly, they're telling us that our lives are not valued. They're not in the same level as theirs. So why can't we take it upon ourselves to show the world that our lives actually matter, and we will come up with a solution for our own problem? I think the solution is creating our own, coming up with our own drugs instead of depending on these companies that only care about making money off of us. Anyways, fam, let us know down below what your thoughts are about this. I am Wongel Zelalem.